Hi, I thought this time I would talk a bit about something that's important to probably everyone listening to this segment. It's about testosterone. I think testosterone is very important to all of us, and this is a somewhat controversial area, even amongst medical colleagues. So the issue I'm interested in discussing is whether someone's actually short of testosterone. So you might have a testosterone deficiency. And sometimes it doesn't present itself very directly unless you're aware of it, and you might need to ask your doctor to look out for it. The symptoms of testosterone deficiency can be quite mild and quite subtle and not very specific, so you can cross over with a lot of other conditions that might actually confuse the issue. So the common side effects of testosterone deficiency are people feeling fatigued, lack of concentration, lack of sex drive, libido. You might have trouble getting erections, but also something like depression could be a symptom of a testosterone deficiency. Other symptoms that some people notice would be maybe a loss of muscle mass and an increase in body fat, but some of those changes happen naturally with age as well. So I'm mentioning because I think in terms of mental health, it's important if someone is depressed that we're aware that testosterone deficiency is one of the possible causes of it. Because if testosterone deficiency is an issue, then replacing the testosterone would significantly help someone's mood as well. So why is this controversial? The controversy exists where you have the natural cutoff levels for testosterone. If someone has very low testosterone levels, for example, in the testings below 6, then there's no question at all someone's testosterone deficient. Then either your GP or an endocrinologist can do further testing to determine if there is a specific cause about why the testosterone is deficient. They'll look for, if there's no specific cause, they might decide to actually treat you with testosterone, which means you take testosterone replacement treatment, which is usually either a topical application like a gel, or an injection. And there are 2 or 3 different injections you can have. The most common would be one that lasts for 3 months, so you only need to have a 3-monthly injection. There are other ways of doing it like implants and stuff, but they're much less accessible and much less popular. However, if your testosterone isn't rock bottom, like if it's below 6, if it's between 6 and 10, for example, most of the labs show that below 10 is considered a normal level, but not everyone would recommend a testosterone replacement in those cases. Part of it is because we don't always know what each person's natural testosterone level is like. And if you have, for example, a testosterone level of 9.5, it does mean that you are still producing a bit of testosterone yourself, even though it might not be sufficient. And the risk of treating it with testosterone replacement would be you actually suppress your natural levels, so it might be detrimental. So it needs some fine-tuning, and I would usually involve an endocrinologist in that case. But also, there's also controversy about what if your testosterone is just above normal? What if it's 10.1, 10.2, where it's sitting right at the bottom of what we consider a normal level? Even though it's within the normal range in the testing sense, but sometimes 10.1 might represent a very low level for someone. If someone's 35, for example, and the testosterone is 10.1, we don't know whether several years before that they might have a testosterone level of 20, for example. So this is where it's more subtle and quite controversial about when you replace testosterone. So I don't necessarily have any answers, but I think it's just something to be aware of. I think if you have some of those symptoms and it hasn't been tested, it's worthwhile asking the question about whether you are testosterone deficient. And if you are testosterone deficient, then to seek whether treatment is a good option for you. But it's not always the right option, but it needs to be explored a bit more. All right, I hope that's helpful, and I hope maybe some people will consider that if it has been considered before in the past. All right, till next time, bye.